Let's bring in Democratic Congresswoman Debbie Wasserman Schultz of Florida. Thanks so much for stepping out to speak with us. Your leader, Jeffries, utilizing this magic minute, is what it's called, to essentially filibuster now for hours against this bill. We've seen a similar tactic previously with Senator Cory Booker, filibustering for 25 hours. Talking is one thing. Should Americans think Democrats have done all they could to stop this bill?
Well, I am so proud of Leader Jeffries, who is our closer on this big, ugly bill. What we have done for the months since President Trump and the MAGA extremists that are his enablers in Congress have introduced this plan to kick 17 million people off of their health care and make the largest nutrition assistance cuts that are going to make people go hungry in American history. Since they started this plan, our goal has been to put a human face on the impact of this big, ugly bill. And what we've done is we've collected stories from people around the country. We've asked people in our districts, and those are the stories about the impact that this bill will have and how it will destroy people's lives, that it will end in the deaths of people who will not be able to get the care they need. And Leader Jeffries is sharing that so that Republicans can stare in the face their hypocrisy. I mean, these are people who are phonies. They've faked that this entire time that they were, had concerns and that they were going to vote against the bill. And of course, they cave like a cheap suit every single time because they are essentially a cult. They care more about power than they do about taking care of people. Ran for a different reason than Democrats did, for sure.
Congresswoman, break down for our viewers then. If you are a family of four in Florida, how would this legislation impact you?
Well, in my district, Anna, we have 31,000 people who get SNAP benefits, nutrition assistance, to ensure that they can put food, affordable food, high-quality food on their table. They'll lose those SNAP benefits, that nutrition assistance, which means that their families are going to go hungry. We have 70,000 people in my district alone, and my district is by far not the largest Medicaid population, but still in my district, 70,000 people will lose their health care. We had our hospital CEOs come and see us just a couple of weeks ago, who are so on the margins, and I represent an urban and suburban district, that they are worried about closures because so much of their Medicaid population will be lost that they won't be able to stay open. That's in rural hospitals in an even more dire situation. And nursing homes will close across the country. Most nursing homes have at least a 25% Medicaid population, many much more than that. So nursing homes will close. Where are those vulnerable seniors going to go? Yeah. All in service to give tax breaks to millionaires and billionaires. The wealthiest 20%, Anna, get the 60% of the benefit in this bill, and the middle class get the crumbs, which expires, and the wealthiest tax breaks are permanent.
I mean, with millions losing health coverage nationwide, the loss of SNAP benefits, the nation's debt increasing by trillions, why are Republicans pushing this bill so hard? Is it all about keeping those tax cuts, or are you calculating maybe that the worst impacts won't be felt until further down the road, maybe the next administration? What do you think?
That's exactly what their top priority has been. Their top priority the whole time has been to make sure that the 2017 tax cuts that were unpaid for then, that blew a massive hole in the deficit, that they're extended because they expire at the end of this year, and that they're made permanent. And they give a handful of middle-class tax breaks that expire in a couple of years. They blow a hole in the deficit to the tune of $4 trillion. This is the party that says that they're fiscally responsible. And then they raise the debt ceiling by $5 trillion to make enough room for those tax cuts. So you can see what this is all about. Massive health care cuts that take health care away from people and make it more expensive. Ending health care access as a result to our veterans, our disabled, our elderly, our children, and making people and families go hungry so that Elon Musk can buy another jet and Jeff Bezos can have another $50 million wedding.
And yet Elon Musk was adamantly against this bill as well. It's hard to see who the fans of the bill are.
Before he was in service to them.
Congresswoman Debbie Wasserman Schultz, thank you very much for your time and offering your perspective.
Thanks,